Viewers, welcome to the Personal Injury Law Show. This show talks about everything coming to the law of personal injuries and obviously of importance to you, the viewer. My name's Tony Carbone. I'm a personal injury lawyer with 30 years experience. With me tonight I've got John Karantzis, partner in the law firm in Workers' Compensation. Good evening, John.
Hi Tony, hi viewers.
And Vivian Ryan, a director at Gravia Media. Good evening, Viv.
Good evening, Tony. Good evening, John. Good evening, viewers.
Tonight, viewers, we're going to have an episode with Danny Hill. He's the Assistant Secretary to the Ambulance Employees Australia, talking about all the assaults that have been encountered by the various paramedics. It's a must-see episode, viewers.
Before we get to that, Tony, what's in the news?
There's been a lot of stories, guys. The one that's really concerning me is that when you park in these private car parking bays, in these various car parks around Melbourne, people are getting fined when you're not paying on time, and also they're getting their personal details and taking them to court. Apparently that's going to be made illegal soon, John.
Well, Jane Garrett, the Minister in the Victorian Government, Tony, is going to pass legislation that will not allow these private operators issuing these fake fines, Tony, to access your details from Vic roads.
Oh, thank goodness, because I have found on a number of occasions at my local supermarket that I've been fined and I actually didn't have to pay those fines.
Exactly.
So a lot of people don't know that because they actually don't have a legal standing
Yes.
to enforce payment. So, you know, this is really exciting because a lot of people have actually been harassed after being given access, after these, parking parking operators have been given access to people's details. People are being harassed by fake
Yeah, they're not
debt
even,
collectors.
yeah, they're making up false names and everything. But the key to it too is it's cluttering up the legal system because they're issuing all these summonses and writs to get penalties that they're not even entitled to claim.
No.
So query it, viewers, if you get one of these.
Don't pay it.
What about this? In the old days, chasey. We used to run around and people used to chase you with a ball.
Well,
and I actually ran into a tree, cracked me a head once.
In my day, it was kiss chasey, but in this day, we're talking about beasting chasey. Essentially, what's happened is this young boy has hurt himself during this beasting chasey practice that's been happening at school. Now, his father's suing for psych injuries. They've already paid, I think the school's already paid $7,500
for dental treatment.
So the kid's running along and has fallen down, broken his teeth, has a psychological claim, Tony, and the parents have issued court proceedings. Basically, is a contention, Tony, that the educator, the school, should not have allowed chasey to occur?
Or have it properly supervised, have lines within which you played a game.
Lines were there, but apparently part of the claim is that...
He ran outside the lines.
Oh, no.
Yeah, but
a kid ran outside the lines, Tony.
Yeah, but...
no.
You could run in... What if you ran into another
Let's
kid?
sue the school.
What if you ran into another kid, John?
Are we becoming...
And isn't that what occurs when you're a kid?
I don't know. I mean, you've got to... I think... There's two sides to the story.
I really think, what society are we becoming? It's so heavily litigious when kids just can't play a game of chasey.
It's a sad case
consequences.
because this kid has serious dental issues. That's clearly the case. And fortunately, the school is doing the right thing and paying for that dental treatment.
I commend the school for doing that, actually. But look, I think there's got to be parameters to these games, and getting them to play within certain guidelines and supervision is pretty important.
So what sort of...
could have been...
I guess we'll wait and see, Tony.
But what threshold would they likely receive in compensation for these psych injuries if successful?
I mean, you know, he's still very young, so you've got to wait and see what happens.
Okay.
Could be 50,000, couldn't it, John?
So it's significant.
Yeah, it could be significant. This one here I like, and I dislike really. You've been an ambassador of Bully Zero, and I'm on the board of Bully Zero. And
great cause.
This poor kid has been discriminated against because of his height. He's over 6 foot tall and he's 14 years old.
So the parents are suing for discrimination because this poor child has been harassed, bullied during the course of his schooling environment. He's 6 foot tall. I find this just horrendous, and it puts the schools on notice that they really need to be doing something to help stamp out this discrimination and bullying.
I'm going to speak to Oscar's Yildiz and tell him to raise these issues as well when he goes out to the schools to talk about bullying, harassment and that sort of stuff. Because, I mean, let's be realistic. if you're too short or if you're too tall, you're going to get picked on, aren't
I mean,
you?
look, I remember being at school and the fat kids were always going to get, they were always outcast. And I think about the psychological damage that would have happened
disastrous.
during those years. I mean, I think everyone has a story to tell, but really the responsibility rests with the schools. They need to be put on notice and they need to be doing something about it.
Well, in this case, they were on notice.
Yeah, and they did nothing.
It's alleged, and it's alleged that nothing was done about it. So
And again,
that is a problem.
Threshold of damages. What could this poor boy likely receive
Once again,
in compensation?
it depends on how serious his psychological damage is. It could be 50, 100, who knows?
Exactly.
Well, it depends on how it impacts on him into the future. So, look, we'll follow up on these stories. What about this person in custody?
Oh, yes.
Dying man brushed off and passed away. Serious Audrey Jamieson.
This is, Audrey Jamieson, the magistrate here, Tony, the coroner. This man was in the custody centre in Melbourne, Tony. His pleas were ignored by the custody officials. He was dry retching. He was literally dying in his cell.
And there's CCTV footage of all of this.
Yes.
And they just ignored him.
Yeah, well, the counter-argument to this is that often the officers say that this is a direct result of not having alcohol or going into
they thought he was
detox mode.
detoxing. Yeah.
So, I mean, I guess the question is, how do you identify? I mean, obviously they needed to
Didn't seem
ensure,
by a doctor.
that there was medical
I mean,
care.
but you've got to err on the side of caution, don't you? Yeah.
Absolutely.
I mean, just because he's in there and, mind you, he's presumed innocent until found guilty.
Exactly.
Yeah.
It's really sad. It's really
This
really
is a
sad.
sad story. Guys, this is very topical. Soon we got Danny Hill coming from Ambulance Employees Australia. A woman died waiting for ambos.
Yes.
It's really,
She
really...
bled out.
Yeah. Well, the thing is, she was in her 70s. She called Triple O, claiming that she'd just taken a scab off her body and it was bleeding. So, the Triple O operator deemed it as not urgent. The ambulance didn't arrive until a couple of hours later. Unfortunately, she was needing to be resuscitated and she ultimately died.
Yeah.
But I just question, it's a really sad story. Our ambulance drivers are under an incredible amount of pressure. So they obviously have a priority system. How could this Triple O operator not or have known that she was going to bleed out from what is seemingly a
At the
scab
same
that you've
time,
picked off?
Viv, a lady in her 70s has telephoned for an ambulance. That in itself marks it urgent.
But 2 hours seems a long time to me too, doesn't it?
It is a long wait, but
Yeah.
as you'll know, as we'll hear from our guest today, the pressures that they're under in order to...
Resources are stretched.
I thought for a while there, it seemed like it was a lot better than what it's been. Do you agree with that?
Now the problems are
It's
coming
starting
back.
to arise again. Anyway, look, we'll take this up with Danny Hill. Viewers, stay tuned. Go to a sponsors break. After the break, let's see what Danny Hill's got to say about this and also the plight of paramedics dealing with injured people. Viewers, welcome back to the show. Before the break, I told you we'd have Danny Hill, Assistant Secretary, Ambulance Employees Australia, on the show. Good evening, Danny.
Good evening, Tony. Thanks for having me.
Danny, in your day-to-day activities in the organisation, what do you do?
Well, we represent all Victorian ambulance paramedics and ambulance employees. That includes the communications staff. It includes the fleet maintenance and mechanics, the people who work in administration for Ambulance Victoria and also in the private ambulance sector. We've got about 3,300 members, so we cover about
Is that
95...
throughout Australia or is that...
No, just through Victoria, but we
Okay.
cover about 95% of all paramedics and members of our union.
And so you're looking at the welfare of the paramedics, also look at their wages and all sorts of things, policy issues.
That's right. We lobby government on behalf of the paramedics. We also lobby on behalf of the patients that the paramedics treat. So we take a big interest not just in our members' wages and conditions and their welfare, but also the service that they deliver to the community, because paramedics care very much about the sort of service that they deliver to patients. And, they want to make sure that's patients are getting the best possible service that they can get.
John, just on delivery of services, you've got a list there of everything that these that the paramedics perform. Can you just run through a few of these things?
Tony, paramedics, in essence, act as a quasi-medical attendant, a doctor at times, Tony. They attend upon people in trouble at their homes, car accidents, at workplaces. It's on an on-call basis, isn't it, Danny?
And they've got to have some pretty good skills because they're performing invasive techniques such as intravenous cannulation, administration of pain-relieving drugs, fluid resuscitation in a trauma setting and advanced airway management. In fact, the other day I had a case of a youngster or a young fellow who was given a Panadol and there was some allegation that he's gone into a coma. I don't know. Do you recall that? Or
Yeah, there was a case recently. There have been a number of cases, and there always are cases where paramedics attend a patient, and then for whatever reason the patient presents in a reasonable condition when the paramedics are there at the time, and the paramedics make a professional judgment not to transport. They never tell the patient we're not transporting you. It's always the patient has to sign, effectively refuse transport when it's offered. But I mean, at all times, the paramedics use the best possible professional judgment that they have in assessing the patient that they have in front of them at the time. And there's one thing about the human body, it's how unpredictable it is. So a person can present perfectly well, with just a slight fever, and within hours, they could deteriorate.
In that case, Tony, where the young kid died, I think he was 17 years old, that's being now investigated.
It is sad, and any case where a paramedic attends and the patient is not transported, but then a paramedic gets called out again within 24 hours. Any case like that gets investigated, and Ambulance Victoria will do quite a thorough clinical review process to make sure that, find out what can be learnt from it. It's devastating to anyone. It's never nice to lose a patient, whether you're treating the patient with every skill you have in your arsenal, and you mentioned some of them there. I mean, people don't realise now that paramedics actually do surgical type procedures out on road.
Yeah.
They can actually insert a surgical airway into the patient's throat. They can decompress a chest through making incisions and actually inserting their finger and clearing out blood clots in the patient's lungs. So it's not like a swoop and scoop sort of... pick up the patient, toss them in through the hospital.
Well, they've got to stabilise them if they can.
That's right.
Before they start transferring.
And many times in very difficult circumstances, you may have to do that on the side of the road in a crushed car. You may have to do it surrounded by people who are aggressive and agitated.
We're going to get to that, Danny. So I don't want to jump the gun. John, of late, in particular with this epidemic of ice, right? There's been an enormous increase in the number of assaults and aggression towards paramedics.
Yeah.
Give me some of the statistics. I mean, and these aren't totally accurate, are they, Danny? Because there's a lot of people that don't report incidents. Is that correct?
Well, notoriously, paramedics underreport incidents of assault and violence against them. And part of that's due to the fact that they're so fatigued at the end of a shift. Who wants to fill out a long incident report at the end of the shift? But also, you become desensitised to it, and you start to get, it becomes the norm that you attend cases and you get assaulted, or you get someone treating you quite aggressively. So you just desensitised to it, which is that's a problem in itself.
Okay. Tony, what
are some of the
happened
figures?
Up to the financial year 2014, for that one financial year, 314 reported assaults on paramedics.
And what are we talking about? Knife attacks?
Knife attacks, punching, kicking, and drugs, particularly ice, Tony, is one of the main factors involved. Now, and that's what's reported. So in essence, there's 2 or 3 assaults happening a day.
Danny, on the issue John just raised now, what's the policy of Ambulance Victoria, for example, if a paramedic goes in and there's aggression shown towards them, or it looks like they're going to be attacked? What's the policy of the...
Well, the policy is that there's a zero tolerance to any sort of violence and aggression towards paramedics, which is a good thing. The danger comes from where the expectation lies with the paramedic. And if you're attending a scene and there are people there who are violent, and they're saying, come and help my friend who's been assaulted or, been punched in the head, they're unconscious. It can be very hard to balance your desire to treat the patient with your own thinking about your own safety. So you may know that it's a very dangerous scene, a very volatile scene, but you feel that you have to go in. You can't just leave a person there to suffer. So the danger is not so much in the policy. All the policy framework is there. It's supporting paramedics when they say, I'm not comfortable going to treat that patient. I don't feel right going to treat that patient. I need to wait for the police to come. It's giving them that certainty that they're going to be supported if they make that decision.
But the police generally don't attend, this is my understanding, John, they won't attend unless a paramedic is under attack.
Yeah.
There's got to actually be
the attack
an
has
act
already
of
occurred.
aggression.
Yeah.
Do you agree? Is that correct?
Either that or a reasonable reason to suspect that an attack will occur.
Yep,
So
yep.
a violent history towards emergency workers, known to carry weapons, things like that.
John, if you're a paramedic and you go to a scene, and the person's probably affected by drugs and alcohol and whatever,
Yeah.
I mean, your initial instinct is to back away and preserve yourself, I would have thought. Do you agree?
It depends on how bad the victim is. If someone's about to die, then the paramedic would try to save him, wouldn't he?
Yeah, but if they're getting attacked themselves,
Then,
it makes it
then you
pretty
might have
hard.
to defend yourself. That's really... It depends on the paramedic, Tony.
Viewers, we've got to go to a sponsors break. Stay tuned. After the break, we'll be back with Danny Hill and John Karantzis to talk about paramedics. Viewers, welcome back to the show. We're talking to Danny Hill and John Karantzis about paramedics, their plight, and how they can help society. Danny, in your past life, you're a paramedic yourself. You did that for 8 years, didn't you?
Yeah, mainly at Werribee branch, in Melbourne's West.
What was the worst experience you had in your travels when you've gone out to treat someone?
Oh, you have a lot of bad experiences as a paramedic. You don't go through the job without having bad experiences, and you go to a lot of cases that stay with you and affect you over a long period of time.
I'm talking mainly in terms of
Assaults
a feeling of being attacked or assaulted or...
Well, I've done a lot of work with patients who have used the drug heroin, and
Yep.
we use an antidote drug called Narcan that we give to those patients, which brings them out of the state that they're in when they're using heroin. Sometimes when they come out of that state, they can be very aggressive and at times violent. And I've been threatened several times, physically threatened. I've also picked up a lot of patients who've been very heavily intoxicated. And when you try to wake them up and get them up off the footpath, someone's seen them lying on the side of the road and called an ambulance to see if they're okay. And you try to wake them up and they're just very intoxicated and they come out swinging at you. So luckily I was never physically assaulted, but
ice has changed everything, hasn't it?
I think ice takes it to a new level where it's it really makes people very, very volatile, very aggressive, very strong. You go to a lot of police will only attend in large numbers to even a young person, like a female teenager.
Well, they feel invincible, don't they?
That's right. Yeah, that's right, and very unpredictable,
And
very
so
dangerous to
as
themselves.
a paramedic, you have to deal with that uncontrolled factor. And what do you think of capsicum spray?
I'm not sure capsicum spray is warranted. I know paramedics in other countries do. I believe in the United States and in Canada, they do issue some paramedics with capsicum spray. I think the key to it, obviously, no one would want to need to carry that. You'd rather the problem not
You'd
be there
rather
in the
not,
beginning.
but here you're in a situation of danger and it seems continuously.
That's right. The thing about with ice, even capsicum spray may not stop them.
Actually, probably won't, yes.
You know what I mean? Someone charges you when they're affected by ice.
We're Workcover litigators.
Yep.
The employer is obliged to provide a safe workplace.
course.
Clearly here, paramedics are not working in a safe
Well, the reality
workplace.
is, when someone gets attacked, John, they haven't really discharged their duty because at the end of the day, everyone knows the risk assessment is poor. Because
No, but Tony, it's foreseeable that these attacks will occur now.
I know. I'm saying the employer's always at fault. That's my
Exactly.
view of it.
Yeah.
Because there are preventative measures that could be taken.
So the employer at this stage is not taking any preventative
Well,
measures.
they're looking into it at the moment.
Yeah, it's one of those things where, as a paramedic, you develop a bit of sort of spidey senses, if you like, where you might get a case and it might be a young person who complains of having chest pain. And unable to sleep, chest pain and unable to sleep, short of breath. And you just get that little feeling that this doesn't sound right, and it sounds like it could be someone who's coming down off ice.
Okay.
And you need to have that assurance from your employer that if you say, hang on, I don't want to attend this case by myself, I'm working by myself tonight, I don't want to go into that job by myself, or if you do go in and you run out the door because you fear for your safety, that you're protected, that your employer says, yeah, that's okay, that you're all right to do that, you were considering your health and safety, so that's okay. I think that's the main protector of paramedics, is having that sort of spidey sense, if you like, and being encouraged to use it and supported when you do use it.
John, Ben Dalton is a paramedic that was attacked last year.
Yes.
Give us some of the background facts.
Well, Tony, he turned up. He was called to a scene. He turned up and the door is open, and guess what? The guy's lunging at him with a knife.
Yeah, they actually got chased down the hallway.
He's being chased down the hallway. There's attacks going on. He's held hostage for a while. It's crazy. And this is a guy at work.
It was a house call, wasn't it?
I believe so, yeah.
yeah.
I believe it might have been an apartment.
In the CBD, yes. Melbourne CBD. Now, we've got a situation where he's had to take a month off because he's had a knife held at him. He's been, held hostage.
Well, they swung at him with a knife too, John.
Yeah.
There's a, big...
and this is a, pretty frightening attack. He's had to have 1 month off. He would have received weekly payments of compensation, medical expenses. But the problem is, these attacks are not going away.
He says, my safety is no longer promised, and he's suffering from sadness, anger, and I think the main thing is that I'm not safe in the workplace.
Once you go through, Ben's a lovely young guy. He's been a paramedic, I think, for about 4 or 5 years. Very good paramedic, very good at his job. But obviously now he carries with him everywhere he goes. He's going to carry that fear of, is this patient another one of them? That can be a healthy fear, but it can also get to the point where you're having nightmares and post-traumatic stress. So,
and it also could impact on his capacity to carry out his job properly.
Of course,
he could get to a scene and probably not really perform at his optimum level because he's working with fear.
That's right. Yeah.
In fact, he even says that he's been in headlocks and verbally abused and spat at and blood thrown at him, feces thrown at him. I mean, it's just bizarre, really, when you think about it.
Danny, is it a question of resources or lack thereof?
At times, you will go to patients who have been waiting longer than they want to wait for an ambulance, longer than they should have to wait for an ambulance, and probably due to a bit of misunderstanding, they take out some of that frustration on the crew when they arrive. And we've had many cases where paramedics have taken too long to get to a patient in cardiac arrest, and the family are there and are panicked and devastated. They know that their family members died and they're furious at the ambos, and the ambos have genuinely gone as fast as they can safely get there. But often they've come from so far away because the local crews weren't available that it can take a long time to get there, and we've had some paramedics get into some very volatile situations because of that.
Danny, is in the States, they've got knife-proof vests.
Stab-proof vests.
Stab-proof vests.
Yeah.
They've got capsicum spray. They've probably got battens, I don't know. Have they got battens?
I don't know about the battens, but certainly there are a number of jurisdictions that have paramedics who are equipped with stab-proof vests. We surveyed some of our members to ask if they thought Victorian paramedics should be issued with stab-proof vests. Surprisingly, most of them said no. And I think the reason was that it would encourage, that there's a risk that it would encourage a bit of unnecessary comfort and confidence, where you might think, well, okay, normally I wouldn't go in, but today I've got my stab-proof vest, I will go in.
Yeah.
I mean, anything like that, if it's there as an adjunct to assist with keeping you safe, then it's probably a good thing. But if it's done in a way to say...
How's it any different to the police wearing bulletproof vests?
How's it any different?
Yeah, I mean, they go in, still thinking to themselves, I've got to be careful because I could get shot at. It's the same with the ambulance paramedics.
In a way, I think there's different roles, and police obviously have a duty to respond to some of those circumstances that paramedics would never respond to those.
Okay.
Look, any of those things that assist with health and safety are probably a good idea, as long as it doesn't encourage, a sense of, confidence that could get them in trouble.
Okay. Danny, thanks for coming on board. We'll get you back
Pleasure.
another time to discuss the plot of the paramedics.
Thanks
John,
very much.
as usual,
Tony.
thanks for coming on
Thanks,
board.
Danny.
Viewers, thanks for watching. Stay tuned for future episodes. Go to our past episodes, Facebook, Twitter, and social media sites. And always remember to stay safe.